Continue to watch what has been a media statement by interministerial committees from the South African government on how they're going to be handling the evacuation and repatriation of some 151 South Africans who are over in Wuhan and Hubei province. Those, and I need to reiterate, are people from South Africa who have been there. They have chosen to come back. Not every South African over there is being forced to come back. There's a lot that came out of that media briefing this morning, including the plans being put into place by the South African government. Professor Wolfgang Preiser joins us now. He is the head of Medical Virology at Stellenbosch University, joining us via Skype. Professor, good morning to you. Lots of plans as far as the government is concerned. Can you tell us what you thought about those plans?
Well, I think this is very much in line with what other countries have done. I think it's probably in the best interest of those who want to be evacuated. This lockdown is now going into its 6th or 7th week, so it's really been a long time. I think that it's more than the actual risk of getting the new coronavirus infection, which is probably quite low now in Wuhan, thanks to all these very drastic measures. I think psychologically people are really taking strain. And then, of course, the big question comes, is it safe? Is it safe for us who we are here and who we do not want this to be imported? And I think that, the plans take care of these considerations. So for the evacuees, another 2 weeks in quarantine is obviously going to be not perfect. It's another 2 week stressful period, hopefully under some agreeable circumstances. But this is, according to what we know now, is the best way to ensure that somebody would not inadvertently import that infection here.
Professor, help me understand. I've seen a couple of questions come through on the ENCA Twitter account. Is every single person, the staff that are over there to assist with the evacuations, and also all 151 South Africans, are every single one of them automatically going to go into quarantine? It doesn't matter whether or not they test positive for COVID-19 or not. Is everyone going into quarantine?
I don't know the exact plans like that, so I wouldn't be able to comment on that. But this is actually what countries have done. And there have been some surprises. For example, the German group that was evacuated, was it 3 or 4 weeks ago? They were all tested and they're all quarantined. And in fact, they found 2 infected people among those who had no symptoms or any signs of illness. So that was a bit of a wake-up call, and it basically showed that if you just check people for a fever when they come back and then say, well, you don't have a fever, you don't seem to have it, you may miss cases. So I think this is in line with best practices, but, we are learning so much in such a fast time here that, it's really impossible to say this is the absolutely correct thing to do. But I think with what we know at present, it's probably the safe thing to do.
As far as your analysis of what government has now announced is their plans, Professor, do you think that South Africa is prepared to handle this? Because there's been some criticism that South Africa isn't ready. What's your take?
Well, again, it's a difficult question to answer. What I can say, and this is actually after my own experience returning back from abroad on Friday night here at Cape Town Airport, I think that we are as well prepared as many other countries, and that is basically on par with industrialized countries. So I don't think there's anything worse about our efforts at recognizing possible cases early and then isolating them to prevent further spread. I think we are doing as well as any other country, and that includes the rich countries. That said, it is not 100% foolproof, of course. I mean, there will still be cases that slip through somehow. That is perfectly possible. And look at what's happening in many European countries now and in the United States, where they have clusters of transmission in the population. They weren't aware of that. So if it can happen to them, obviously it can also happen to us. I mean, nobody is going to say this is impossible. We are learning very fast, but remember, this virus has only been really discovered 2 months ago. I mean, this whole outbreak was unknown until the last day of December last year. And now we have the first day of March, the subsequent year. And there's so much we can do, so much we have learned. But of course, we keep learning, and there's many things that we don't fully understand yet. But I think measures like people who have been to high-risk areas, to have them quarantined for 2 weeks, which is what we think is the maximum incubation period, I think these measures are really as good as it gets.
Professor, before I say goodbye to you for this morning, and again, I do thank you for your time, sir. Approximately 32,000 people recovered, 46,000 still in recovery, some 2,900 deaths. You work out the mortality rate on that, Professor. It's relatively low. It's 3%. We're hearing it's less than influenza every year. Globally, let's move away from South Africa. Globally, do you think authorities are on top of this? We're seeing a slight decline in numbers, but that's not necessarily good news.
Well, it's actually not less than influenza. It's many times over that a typical seasonal influenza causes. So, but that is now the number of deaths per people infected. And of course, we don't really know the numbers infected at this stage yet. We think they are higher than what we count because there may be unrecognized cases out there. And that would be actually in our favor because that would mean that the risk of dying if you get the infection is even lower than that. However, 2%, if you assume that a large proportion of a population, a given population, would become infected, then 2% or even 0.2% would still be huge numbers of people. So our efforts are once, and I think that's where the European countries are definitely moving towards now, once we have realized that this is here to stay, we are not going to prevent the importation. It's with us already. So I'm not talking of South Africa now, I'm talking of other countries. And those countries are now trying to slow its spread. The idea being that you don't want everybody becoming infected at the same time, around the same time, within a few weeks or, very few months, and then have an enormous burden on the healthcare system. Remember, the people who are elderly and risk people, they might need intensive care unit treatment. They may need to be ventilated. So there is limited capacity for that. So the idea here is then to spread it out and to lessen the burden on the health system to ensure the best possible medical care for those who are infected. And I think that's something where we are not yet. We are still trying to keep it back. We don't want it imported into South Africa. And this is why the returning people from Wuhan are, being treated as they are. But eventually, if once the, large parts of the rest of the world basically give in and recognize this is not going to be contained, we will also move to that type of approach. And then it's all about ensuring that whoever comes down with it gets the best medical care in order to keep the mortality rate as low as it gets. But don't underestimate it. It may not be Ebola, but if everybody or, large proportions of the population get it, even a mortality of 2% or even 1% would translate into enormous numbers of people.
So I appreciate your time in speaking to us this morning here on ENCA. Professor Wolfgang Preiser, he is the head of the Division of Medical Virology over at Stellenbosch University.